session. Okay, so this subject is Introduction to NABL students, which is 1 credit course. So 1 credit course means you will have only 1 class per week. So it is not core subject, but it enhances your technical skills in your field. So this particular subject is very important because we are gonna establish our own labs, or we will work in highly established labs. So anyway, this subject will help us to guide on how to maintain the quality in our professionalism. Okay, like how to maintain quality in medical lab fields, in diagnostic labs. So that is the main intention to keep this subject in your course, okay, which is the Introduction to NABL. So coming to the subject code, which is 20 MLY 311, your 5th semester currently. So let us see what is this NABL. Okay, let me go to the syllabus. Syllabus is very straightforward, students. Only 3 units are there. Unit 1 is a scope and management requirement of NABL, then technical requirements and types of fields of accreditation, and third one is guidelines of operation control centers of in medical lab technology. So how we can able to implement NABL guidelines in medical lab in order to achieve the accreditation. So before discussing about all this NABL, first 1 week, actually I don't have much time. First, let us try to have a summarize and overview on what is NABL and why do we require NABL, and what is the significance of safety, errors, and why do we need to seek NABL in the first place. See, I have 1 crore rupees lab in my, I kept a 1 crore lab setup. Okay, I know my instruments are good, and why do I need to opt for NABL? Why I need license from NABL in order to run my highly established lab? So what is the role of NABL? That we will discuss. Okay, so before discussing about NABL, I would like to tell about few problems that we are facing with the clinical testing laboratories. So first question that I want to address is how many number of labs you are thinking that they are accredited in India? Any guess, students? How many labs may get already got NABL accreditation? Maybe 100, 200, 300, 10,000, 20,000, 50,000, 1 lakh labs. We have medical labs, diagnostic labs for every street, right? Every street, every village, every hospitals, almost wherever there is a hospital, there is a lab. This is the situation in India, right? So we have labs everywhere. We are seeing labs everywhere, in every corner of the street, in every turning of the streets. So out of these labs, how many labs may got the accreditation? Any idea to you? How many labs may got a NABL accreditation? Believe it or not, students, I just seen the status of NABL accredited labs right now in India. Someone saying that okay, maybe how many you're saying? 25%. Okay, so 25%. Someone said a really nice answer, Sangeeta. 25% maybe. See, 25% means I hope there are almost 25 lakh. Okay, 1 lakh hospitals for assume. Okay, out of 1 lakh, 25% means 25,000. 25,000 labs must get accredited in India. Okay, the scenario is, you won't believe it, there are only 1,700 labs has been accredited by 2021, and another 700 labs are in the process of getting approval from NABL. Overall, there are only 2,600 labs are equipped, are ready to are satisfied with NABL needs. This is the status in India. We have less than 3,000 quality labs in India, in diagnostic labs. The statistics, I was really surprised to see the statistics. So whatever labs we are seeing in the street corners, they are the best labs. If they are best, they must get accreditation, right? So yes, there are many labs which are working, which are running, taking public samples and they are processing without the basic criteria that NABL is asking. So-called, they are saying they are maintaining quality. I don't know on what basis they are maintaining quality. If they really have quality, then they must get NABL accreditation. So yes, this This problem need to be answered. Why there are many labs working without NABL, and what is the significance of having an NABL? How an NABL lab differs from a non-NABL lab. I want to tell one more important point here. See, I have a NABL lab with 10 lakh overall budget investment. So this lab cost is 10 lakhs. And I have another lab which is 1 crore. It does not have NABL. How 1 crore non-NABL lab is differ from NABL small lab? How come a small lab achieved NABL accreditation, and why not a big lab didn't achieve NABL accreditation? What is the difference? How a Chota lab succeeded at getting NABL? What parameters does the small lab satisfied, showed to get an NABL? And what, definitely, even though it is 10 lakhs lab, a small lab, still it has good quality control compared to the big lab. And that is what we are going to study. How NABL propels us towards achieve the control, the quality. How NABL will guide us to maintain quality. Very simple. I want to tell by this analogy. Small lab, big lab. Small lab has NABL, big lab don't have NABL. Keep in mind. Now, the number of patients dying, okay, the death rate of improper results by the lab, by the big lab will be 10 people will die per a week by big lab errors. Whereas an NABL lab, the rate of error will be 1 people will die per year. That is the significance of having NABL. NABL will minimize patient death. NABL will give us the guidelines in order to maintain the quality of the lab, no matter whatever size it is. It's a small or it's big. It don't mind your lab size. It needs certain quality standards. If you are maintaining the standards, we will give you the NABL. So that is the primary agenda of NABL. NABL is to minimize the errors and to give proper qualitative medical lab services or quality services to the patients. Okay, so that is what NABL primary agenda. So let us see what is this NABL. So before NABL, I will tell some other things like safety concerns. Okay, so safety concerns. So as we stated that NABL have certain quality measures, or it will give safety to us. So let us generalize this safety to the common fields. Okay, there will be many road accidents. So there are some safety issues with the transport department. So they are happening. So I want to shift this safety towards aviation industry. So in aviation, we will rarely see a flight accident, very rarely across the world, not in a single region. Very rarely. Per year, we will see only 1 or 2 aeroplane accidents. Very rarely only, that also. So that means the aviation industry has succeeded at giving quality services to the people, to the society. The chance of dying in a car or on a motorcycle is higher than the chance of dying in an aeroplane. Air transport is the safest transport as of now. Currently, we have air travel is the safest travel, because that is what the statistics says. When an airport achieved quality to the level where there is very minimal people death, then what about quality in healthcare industry? What level of quality controls we need to take when we are dealing with a sick patient, a patient who is ill? Surprisingly, students, the level of quality we achieved in the aviation is far exceeding than the level of quality we haven't achieved in medical lab or in healthcare industry. There are many errors still we are doing in medical sector. There are still many things that we need to achieve quality in medical care, but that doesn't happen, and that shows us our weakness. Our weakness shows in our results. Actual medical care don't have any quality, but in aviation got quality. So that shows our weakness. And I want to tell this by some philosophy or some some quotations. So yes, why we are not achieving quality? Then you will say, yes, sir, we are humans. We will do errors. At last, we are at the end of the day, we are not robots to not to make any mistakes. We are not supercomputers. We are not artificial intelligence, or we are not any sentients to make everything perfect. After all, we are humans and we will make mistakes. Yes, I do agree that humans will make mistakes. We will learn from our mistakes. I'm agree. So now I want to show you some famous quotations by human errors. Okay. So we know who is this. He is Elon Musk, and he did many tremendous advancements in rocketry or in the electric cars. And he used to say a quotation that failure is an option here. If things are not failing, we are not innovating. Yes, we need to make mistakes and we will learn from our mistakes. That is true according to the rocketry or any mechanical industries or any other industries. And there is one more quotation by this Nobel laureate. If you do not make mistake, you are not working hard on your enough problems. So we must make mistakes and mistakes will guide us. Yes, that is correct. So these are the justifications that we are good. Even though we are making mistakes, that is fine. So they are trying to give a justification regarding making mistakes. Okay. So there is one more quotation by Confucius. To err is human, to forgive is divine. He said it. Our Alexander Pope, he said, making error is human fault, but forgiving is a divine activity. So you made mistake, then you forgive. Okay, then you are saying, I'm sorry, I'm apologizing you, I did a mistake. And that is a divine characteristic. Okay, maybe these quotations may work in engineering fields or any other fields of any science or any other things. But can you take this excuse in healthcare industry? Can you take an excuse that you did a wrong thing in the lab, you killed a patient, after patient death, now you're telling, sorry sir, I killed your son or your daughter, it is because of my mistake. Is it appropriate to make mistakes in a healthcare industry? Can a dead body, can a dead patient forgive us? A patient who has died because of our errors, that dead patient can forgive us. It can be he or her, he or she. So yes, we should not make mistakes in healthcare industry. No matter is it's a surgery, it's a pharmacy, it's a medical lab or anything. There is no room for error in healthcare. That is what I want to tell. Not at all acceptable. Yes. So yes, so then, so as I stated, even there are less accidents in aviation compared to healthcare. So this need to be addressed. How to minimize errors? How to minimize errors is our first priority. And why we need to minimize errors? To minimize the patient death, to increase the chance of survival for the patient, to give a chance for the patient to see the next sunrise. So yes, maintaining quality is important, and that is what this NABL states. Now let us see what are the reasons of errors and what type of errors we will usually encounter in hospitals. Okay, so out of 10 patients, 1 patient is dying because of medical error. Because of a medical error, 1 patient is dying out of 10. Keep in mind, that means this error is preventable. Just because of our negligence, 1 patient is dying. This happening everywhere, students. As see, one of my friend, okay, after intermediate, he took dialysis, diploma in dialysis. And yeah, someone saying about some other case. It's nice that you're actively engaging in classes. Sumit is saying something. Anyway, yeah. So coming to my friend's thing. So he studied diploma in dialysis. Immediately after intermediate, he haven't went for higher studies. Rather than he took dialysis, and he started doing his work in the hospitals as a dialyzer. So you know, right, what is dialysis? So we will take the patient blood, from the patient who has a problem with the kidneys. So we will take the blood, we will keep it to a machine, just like our aqua purifier in our homes. So that will purify the blood and it will re-inject back to the blood. So if you do any mistake during this protocol, you will die. That's why we will take informed consent from the patient that during the procedure, if you die, I'm not responsible. And then I asked him, how many deaths you are seeing per day or per week or per month? Then he said, usually five patients are dying every day in dialysis wards in government hospitals. He's working in government hospital. Seeing death is his everyday activity. He will see at least 2 deaths per day in the dialysis ward. And I was really surprised by his statement. So, and I asked, what is the problem? Then he literally is blaming, even he has killed many patients, and he's telling the doctors are not minding us. They're giving everything and we are keeping filters. And once the patient getting complication, doctors are in another ward. By the time their arrival, patient is no more. Or the staff, ward nurses, they are starting giving corticosteroids. They're trying to manage the patients. If it is not possible, then going to the junior doctor. If junior doctor can't do it, then it is going to the senior residents, the senior most doctors. So yes, they, to my knowledge, even my wife recently, she delivered a baby boy. Even see, what I felt is there is so much negligence in healthcare industry. I don't know why, but the people who are working in hospitals have more negligence behavior. I have seen this, personally in the hospitals. I don't know why. What characteristics, what attributes, what factors lead to develop this kind of behavior among the healthcare staff? I don't know. Yes, the workplace is challenging. We need to go with anytime there will be any things, and there will be many frustrations, so much stress on us. But that stress cannot be shown in your skills, right? You cannot show your stress on your skill, and you cannot delay the primary support to the patients. So yes, there are many things that need to address, and that will be addressed by NABL. NABL given as a systemic approach of identifying the errors, systemic approach of assessing the errors, pinpointing the error, rectifying the error even before the error gonna happen. So there is a predictive system to assess the errors and to minimize the errors to an extent where there is a minimal death to the patient. Okay, so yeah, and another statistics that I have seen in medical errors, 66%, 60% of errors is not made by the staff. That is really interesting. I was really surprised by this statistics. 60% of death to the patient caused by, not by doctors, not by staff, not by pharmacists, not even by lab technologists. 60% of patient death is because of patient only. Patient himself making mistakes because of patient own decisions, patient own, authoritative. Even that is what ethics says, autonomy. Ethics say that we should respect patient autonomy. We should respect whatever patient feels right. That should be done by patient. And that is the problem. That is why we are unable to manage the quality in healthcare. The reason is the patient solely taking his own decisions. If he feel comfort, he will take tablets. If he won't feel comfort, he won't take tablets. That is why sometimes in case of such sensitive issues, we will opt the patient into inpatient. We will take the patient into the department, into the ward, and we will give tablets in our observation. Anyway, the reality is 60% of errors occur due to accidents by patient. Okay, they won't listen. That is patient problem. So we need to monitor the patient first. Okay, and that is a reasonably considerable thing, right? Because patient will be in that sick state and he will have that psychological problems, financial problems, socio interaction problems. So yes, so managing the patient's health, mind status is the biggest challenge for every nurse. Some patients will show frustration. Some patients will show lack of motivation. They want to die. So keeping this patient in positiveness is really a toughest task, and that will be done tremendously by staff nurses. That is why I really have good impression on nurses. They are doing real, they are in direct contact with sufferers. Sometimes they will be harsh, but they are doing that for good thing only. Anyway, so that is what the stat says. Okay, 66% errors is by patient, 16% is by hospital staff, 14 equally contributed by staff and patient, and 4% by accidents. It can be physical accident, mechanical or electrical accidents. See, maybe we cannot control patient, but at least we must minimize the errors which are in our control, such as electrical accidents can be controllable, staff can be controllable. We can give periodic training to the staff. So let us see what are the errors and how to what are the controllable errors that we can minimize. Okay, so this slide explains about the rate of errors occurring by various people in the hospital. 66 by patient, 16% by staff, 14 by staff and patient, and 4% accidents. This is what the errors are going on. So I'm just keeping these things, okay, basic things about yeah. And we have hospital acquired infections. That infections will kill the patient, and needle stick injuries will kill the patients. Sometimes even colleagues, co-workers will get affected by needle stick injuries. So there are many things that we need to see in hospitals. So basically, the safety. Okay, when we are saying minimizing errors, that means we are trying to provide more safety to the patient. So in a nutshell, the definition of safety can be stated like this. It's a mnemonic. So we need to sense the error. What is the meaning of safety mean? First, we need to sense the error. We need to know where is the error happening. Then we need to act accordingly to prevent the error. The right way of approaching to minimize the error also important. So we need to act to prevent the error. We need to follow certain safety guidelines in order to minimize the errors. We need to, okay. Sometimes what happens is some staff member, he will make a mistake. After making mistake, he won't tell to anyone. He knows the error. He knows that because of some battery disconnection to the life support machine, the patient died, and he will think that maybe he did the fault. Because of his fault, patient may die. To keep his job secure, he won't tell this to anyone, and that is one important problem, students. If you make a mistake, we should be responsible of our mistake, and we must inform this mistake to the higher authority. Okay, we cannot be selfish to keep our job secure. By keeping our job secure, we are potentially exposing many patients to death. Okay, we should take responsibility of our mistakes. Okay, we should inquire about the previous deaths, and we should have that sheet also, the history of past incidents, past accidents, what is the reason, and we need to rectify that issue. And also we need to take appropriate remedial measures in order to prevent such errors in the future. Okay, so yeah, this is what the safety means. How we can achieve safety, how we can able to minimize the patient death means by sensing the error, by acting accordingly, by following safety guidelines, by inquiring the past deaths and accidents, by taking proper remedial and appropriate measures, and being responsible of our mistakes. Okay, so by this we can minimize it. Okay, so then, so patient safety is all about this one. So yeah, I'm just doing all these things. So what types of medical errors we will see? Let us categorize these medical errors. So there are many types of medical errors. Medical errors can happen at due to administrative actions, therapeutic actions, preventive actions, diagnostic, and other errors. So administrative actions means here, really interesting, students, administration, admin. Here, whenever you are coming to the hospital, they will take your data, right? That is called admin work. Even their error can happen. So there are two Vamsis, Vamsi Kumar and Vamsi Krishna. So he mismatched it. Rather than giving treatment to the Vamsi Krishna, he given treatment to Kumar. So the patient may die. There is a problem with the identification of patient with error in the filling system. Or we got two patients, Vamsi 20 years old, Vamsi Kumar 20 years old, and Vamsi Kumar 50 years old. So a 50-year-old treatment given to 20-year-old and 20-year-old treatment given to the 50. Game over. So yes, we need to, the first mistake we will do is at registering the patient into the lab. That's why we need to carefully register each and every parameter of the patient details, his clinical, his name, age, sex, clinical history, his guardian, physician, his status, his clinical, his past conditions, his past reports. All these things need to be filled properly. That is why today we are opting this other mediated filling system. So we are taking his Aadhaar number as a primary source of contacting the patient. So by taking his Aadhaar number, we are keeping all the data in the Aadhaar number. So there will be less errors. Okay. So these are administrative errors. Then miscommunication. In my state, I'm from Andhra, and we have recently, our state government has opened AIMS in Mangalgiri. Mangalgiri is my region, my city. So just 1 kilometer away from my home, we have AIMS, and AIMS will be recruited by, it's a national wide exam. So all national wide people will get recruited into the AIMS. And when I went to the AIMS, I was really worried because AIMS may have many Hindi people and many people are from local Telugu people. So there will be this communication problem. Because of this communication problem, also errors can happen. You know, patient want to tell that he has stomach pain. He don't know English. He know only Telugu, and the staff don't know Telugu. In order to compensate those errors, always this central government organizations will take a contract-based localized people. So the local people will help the senior doctor to understand the patient. So communication also important, because lack of communication, error can happen. Filling systems can cause errors can happen. Then therapeutic actions. During the therapy, during the treatment, we may make some mistakes like lab testing, surgeries, and responding to treatment. So our lab test comes in therapeutic actions. So improper lab test can cause patient death. So this is how we will enter into the scenario. So our lab test plays a very important role at therapeutic action, and our lab test also plays an important role at diagnostic actions. Okay. Improper identification of patient condition. He has a malaria positive, but we given another positive, and the patient will get wrong diagnosis and he will die. This is what happened in Kerala last 3 years ago. A woman came to hospital suspected with some breast cancer. She got some nodules when she is palpating her breast. She suspected some nodules, and she went to the doctor, and doctor concluded that it might be a benign cancer. And what doctor did? Doctor started keeping the patient in chemo. Okay. Even after chemo, she is unable to recover from the benign tumors. Then only we came to know that it is not even chemo. It is not even cancer. Patient got a simple fibrosis. Fibrosis is just a tissue necrosis condition, which is not a cancer condition. That tissue fibrosis can be treated by antibiotic therapy. It happened due to some nocardia, some bacterial infection. Because of the misdiagnosis, the patient became critically ill because of the chemo, and she died. And who is responsible? Doctor is responsible. Doctor did misdiagnosis. Misdiagnosis happened because of lack of proper lab test. Doctor haven't ordered proper lab test. Simply he went for his own, he thought it is cancer and he started chemos. So many errors happening like this. So yeah, now we understood that there are many types of errors, and now we should take countermeasures to minimize these errors. And all these things will be addressed by NABL. NABL is trying to identify all these errors, and NABL is trying to minimize the errors by certain standards, certain quality standards. Okay, so that we will see. Now, this accreditation authorities, we have two authorities in India. One is authority that will mind about the hospital administration. The errors that happening, in a hospital, starting from patient recruitment to the patient dispatch. It can be surgeries, it can be pharmacy, everything will be controlled by NABH, National Accreditation Board for Hospitals Administration. NABH will take care of a hospital, whereas laboratories will be taken care by NABL, National Accreditation Board for Testing and Testing Laboratories. Okay, so NABL will take care of labs, whereas NABH will take care of hospital things. So we are going to study from a view of labs. Okay, what type of errors we will see in the lab. We are not going to mind about the hospital errors. That is taken by the separate body. Okay, hospital issues will be taken care by NABH, but NABL will only address about the quality of the testing and diagnostic parameters in the patient care. What diagnostic errors we will get, what other branches of diagnosis, lab testing will get effect that eventually may cause patient death. So NABL will only study about the lab testing errors. Okay, so yeah, so this is all about this one. Yeah. So yeah, there are many safety. Safety comes in many things. Okay, when I say lab, now see, now I'm now making you to off track from the thing. So when I say only lab, that doesn't only the lab. Lab also must need the following safety considerations. It should have continuous. It should have electric safety. There should not be any loose plugs. If there is any loose plug, lab will burst. Fire accident may happen. So electrical safety is important. These are the safeties. Apart, all these small safeties will contribute to the patient safety. They are not directly connecting to patient safety, but they are certain factors that will contribute to the overall patient safety. That includes electrical safety, surgical safety, medical safety, environmental safety, equipment safety, blood safety, and sanitization safety. So even though NABL will give accreditation to a lab, it will mind about these safeties, whether you have a proper electrical safety or not, whether your lab has a surgical safety or not. When we say surgical safety, well, say for example, we need to take a biopsy. Okay, biopsy means definitely, even though yours is a lab, still your lab must facilitate a surgical room, a basic surgical room that can able to provide us a small biopsies. So surgical safety, medical safety, you should have a proper medical officers. Then environmental safeties, equipment safety, blood safety. Okay, so all these things will be addressed by the NABL. So yeah, so I need not to discuss much about environmental, all these individual safeties, right? So environmental safety means it should be well ventilated, well illuminated, the floor should be clean. All these things will be environmental safety, well ventilated, fire extinguishers, everything. Then medical safety, properly admitting patient and taking his data into the lab. Okay, all these things will come in medical safety. Then surgical safety, you should do surgery on the right patient, not on everyone, right? So surgical safeties. Then electrical safety, no loose connections, no sparking plugs, nothing. Everything should be fixed. Then electrical safety also says about a continuous power supply to the lab, irrespective of your Sarkari sector. Okay, you should have a continuous generator and UPS to maintain a continuous electricity to the labs. That is electric safety. Fire safety. Obviously, we are dealing with many chemicals which are fire hazard. So there is a chance of getting fire. So we must need a fire safety alarm systems in the lab. And we need blood safety. Most of the diseases, most of the fatal conditions occurring because of improper blood transfusions. So blood safety plays a vital role in labs. Okay, so before we are releasing anything, any body fluids, that need to be checked properly before it is injecting into any other patient's blood. So blood safety, lab safety. Okay, so there are certain improving safety tips are there that we will see in the next class. Okay, in the next class I will discuss about quality. So in today's class I'm just summarizing it because I have only 1 minute. So in today's class we discussed about the importance or what is error. Then we discussed about types of errors. Then we discussed about the minimum, the basic definition of safety. Then we discussed about different types of medical errors: administrative, therapeutic, preventive, diagnostic, and medical errors. Then we discussed about various types of safeties in the hospital, the definition of safety and the various types of safeties. Okay, so this is all about today's session. In tomorrow's session, I will discuss about the importance of quality in the safety. Okay, well, how a safety is differ from a quality. Just telling I will safeguard the patient is not sufficient. We need to maintain the quality of the service that we are providing to the patient. So what is the definition of quality and how quality can be achieved, and what parameters we will see in the quality, and what things that the NABL is requesting, that we will see in the next lecture. Okay. So thanks for today's class. Yeah, thank you very much, students. So I hope you understood this one. In next session, we will go with this quality. This is also really interesting area. Okay. So thank you very much, students. I'm going to end this session. Yeah. Thank you very much.